And welcome to my PowerPoint presentation for environmental health hazards in schools. My name is Lisa Siam, currently going to ECPI University. The course is Nursing 444L Community Health Lab. My professor is Dr. Julie Townsend, and today is September 22nd, 2024. This lesson will educate the school community on preventing environmental health hazards by teaching them to identify these hazards, monitor and report indoor air quality, and manage symptoms related to these risks. So we're going to dive into three objectives. The first objective is identifying safety risk associated with environmental hazards to prevent adverse health impacts. Objective 2 is how to report air quality hazards that affect health. And objective 3 is how to manage respiratory allergy symptoms. Okay, so with this slide, I want you to begin considering potential environmental hazards in a classroom. So take a look at these pictures and identify any hazards that can impact a person's health. So the top left-hand corner, the picture is showing a little girl doing a little bit of dusting. So dust is the concern in that picture. The top right-hand picture is going to be the bunny. The lady is holding the bunny with her hands. Touching pets, definitely want to wash your hands. The third picture, bottom left, is the classroom. You see the moisture damage on the ceiling tiles in the classroom. And then the bottom right-hand picture is a lady spraying on bacteria, viruses, it could be mold. Obviously, it's not supposed to be there. So think about those things as we move forward with the presentation. All right, so objective 1, identify safety risks associated with environmental hazards to prevent adverse health impacts. So what are environmental hazards? So environmental hazards are potential threats to human health and well-being arising from various environmental factors. So understanding these risks are crucial for implementing preventative measures to protect health and the environment. So some environmental hazards are air pollution, water contamination, dust, cockroaches, rodents, classroom pets, dust mites, fungus, and pollution. Health impacts of environmental hazards. So these hazards can negatively impact health in short-term effects and long-term effects. So with the short-term effects, it can cause headache, nose, throat, eyes inflammation, coughing and painful breathing, and pneumonia, bronchitis, and skin irritation. Long-term effects, it can affect the central nervous system, which causing headaches and anxiety, cardiovascular diseases, respiratory diseases such as asthma and cancer, impacts on the liver, spleen, and the blood, and impacts on reproductive system. Health impacts of environmental hazards. So respiratory diseases. Exposure to pollutants can increase the risk of respiratory infections such as bronchitis and pneumonia. Air pollution can trigger asthma attacks and worsen symptoms in individuals with asthma. And certain air pollutants are known carcinogens and can increase the risk of lung cancer. Increased levels of air pollutants can exacerbate allergic respiratory diseases such as allergic rhinitis. Continuous exposure to high levels of air pollution can impair lung development in children and reduce lung function in adults. Heart disease. So exposure to fine particles can trigger cardiovascular events such as heart attacks and strokes. Exposure to chemicals like heavy metals, pesticides, and industrial pollutants can contribute to the development of atherosclerosis, hardening of the arteries, and other heart conditions. Also, living in areas with high environmental adversity, such as poor air quality and limited green spaces, can double the risk of developing heart disease and stroke. Cognitive deficits. Exposure to certain pollutions has been associated with lower IQ scores, reduced cognitive function, poor academic performance, attention problems, behavioral issues, attention deficit hyperdisorder, anxiety and depression. Environmental toxins can cause oxidative stress, chronic inflammation, and endocrine disruption, which can negatively impact brain development and function. Cancer, so exposure to air pollutants, pesticides, radiation, and smoking tobacco is associated with higher risk of childhood leukemia, neuroblastoma, and other cancers as well. Preventive measures and safety practices. So avoiding allergic triggers. What we want to do is regularly wash any linens in hot water to kill dust mites. Frequently clean and dust surfaces with a damp cloth to reduce dust buildup. We want to rinse nasal passages with saline. That can help alleviate allergy symptoms by removing allergens and irritants and reducing congestion, sneezing, and the runny nose. We want to ensure proper hygiene practices are followed when handling pets, including hand washing. We want to shut windows during pollen season and ensure adequate indoor ventilation. And we want to avoid smoke and fragrances in a closed room with minimum ventilation. We also want to install HEPA filters in air conditioning units and heating systems to capture dust particles. We want to use dehumidifiers to keep indoor humidity levels low, as dust mites thrive in high humidity. We want to seal cracks and openings in walls, floors, and windows to prevent pests from entering. And definitely use pest control services if absolutely necessary. And we want to repair any leaks or water damage promptly to prevent mold growth. Objective number 2, how to report air quality hazards that affect health. Air quality monitoring methods and indicators. Monitoring air quality is crucial for maintaining a healthy learning environment. Key indicators include temperature, relative humidity, air movement, airflow volume, and carbon dioxide levels. Temperature control is essential for comfort and can affect concentration and productivity. Relative humidity should be kept within an optimal range to prevent mold growth and dust mite proliferation. Adequate air movement and airflow volume help ensure proper ventilation, reducing the buildup of indoor pollutants. And monitoring CO2 levels is vital, as elevated concentrations can lead to cognitive impairment and fatigue. Regularly assessing these factors helps create a conducive and safe educational atmosphere. How to read the air quality index reports. So air quality is measured on a scale from 0 to 500, with the higher numbers representing more particles in the air. You may access air quality index information on the United States Environmental Protection Agency webpage. Reporting procedures for air quality hazards. So we always want to report any air quality hazards to your chain of command, of course. Report to school administration or safety team in charge of the air quality hazards. We want to report to the Occupational Safety and Health Administration, which is OSHA, and also report to the Environmental Protection Agency, EPA. Objective number 3, how to manage respiratory allergy symptoms. Common respiratory allergies and their triggers. Pollen allergies. So pollen from trees, grasses, and weeds can trigger allergic reactions. Common types include tree pollen in the spring, grass pollen in the summer, and weed pollen in the fall. Dust mites. Microscopic organisms that thrive in household dust, particularly in bedding, carpets, and upholstery. Mold spores. So mold grows in damp or humid environments, releasing spores into the air that can trigger allergies. Then we have pet dander, tiny flakes of skin shed by the pets, which can be cats or dogs, that can become airborne and trigger allergic reactions. And then we have pollution, air pollutants, including particulate matter, ozone, nitrogen dioxide, and they can all irritate the respiratory tract and trigger allergic reactions as well. Avoiding triggers. So with pollen, you want to stay indoors during high pollen times, typically early morning and late afternoon. We want to keep windows closed during peak pollen season, and we want to use air conditioning with clean filters to reduce pollen exposure indoors. So with dust mites, we want to use dust mite proof covers on pillows and mattresses, wash bedding weekly in hot water, vacuum regularly with a vacuum cleaner equipped with a HEPA filter. Mold spores, we want to fix leaks and control indoor humidity to prevent mold growth. We want to use a dehumidifier in damp areas like the basements. And we want to clean moldy surfaces with appropriate cleaning solutions. With pet dander, we want to keep pets out of the classrooms if we can, bedrooms, and off upholstered furniture. We want to bathe and groom pets regularly, and we want to use high efficiency air filters and vacuum cleaners designed to trap pet dander. With pollution, we want to check the air quality reports and limit outdoor activities when pollution levels are extremely high. We want to use air purifiers with HEPA filters to reduce indoor air pollution as well. Using air purifiers. So when choosing an air purifier, we want to select an air purifier with a HEPA filter, which can capture small particles like pollen, dust mites, and pet dander. We want to make sure we are properly placing the purifiers in common living areas and bedrooms to ensure they effectively clean the air where you spend the most time. And regular maintenance, regularly cleaning or replacing the filters according to the manufacturer's instructions to maintain effectiveness is extremely important. Management strategies for respiratory allergies, medication, and treatment. So over-the-counter medications, there are antihistamines, decongestants, and nasal corticosteroids that can help manage allergy symptoms. There are prescription medications. So the parents and legal guardians need to be consulting with a healthcare provider for stronger medications or allergy shots, such as immunotherapy, if over-the-counter options are insufficient. Creating a personal action plan for managing symptoms. So each student should have a personalized action plan for managing allergic reactions. This should identify specific allergens, outline preventative measures, and detailed steps to take in case of exposure. It should include strategies for avoiding triggers, guidelines for medication use, and instructions for notifying parents, legal guardians, teachers, or staff in case of emergencies. So we want to identify the triggers. We want to keep a diary or use an app to track when and where symptoms occur and identify potential triggers. We want to work with a healthcare provider or to confirm triggers to develop a tailored management plan. We want to develop prevention strategies. Implement strategies to avoid or minimize exposure, such as keeping the windows closed during pollen season, using dust mite covers. We want to create a clean and allergen-free home environment by using air purifiers, regularly cleaning, and managing humidity. We want to do medication management, create a schedule for taking prescribed or over-the-counter medications, include any preventive treatments recommended by their healthcare providers. We want to include steps to take in case of severe allergic reactions, such as carrying an epinephrine auto-injector if prescribed. Lifestyle adjustments. Adjust activities based on the allergen forecast, such as staying indoors on high pollen days. Incorporate habits that support overall respiratory health, such as staying hydrated and maintaining a healthy diet. We want to regularly review and adjust the action plan as needed based on changes in symptoms or triggers. Schedule a periodic checkup with the healthcare provider to reassess allergy management and treatment effectiveness. So, in summary, it's crucial to understand environmental hazards to protect health, especially in our schools and communities. Hazards such as air pollution, water contamination, dust mites, and mold can greatly affect respiratory health and overall well being. So, taking preventative measures like keeping things clean, using HEPA filters, and ensuring proper ventilation can significantly reduce exposure to these risks. Additionally, awareness of air quality indicators and clear reporting procedures empowers individuals to proactively manage environmental health issues. By identifying respiratory allergy triggers and creating personalized action plans, we can effectively reduce symptoms and improve our quality of life. Together, we can create a safer and healthier environment for everyone. So thank you so much for your attention to the PowerPoint presentation. We kindly ask you to take a few moments to complete the anonymous quiz about your understanding of the presentation. Your feedback is valuable and will help us improve future sessions. Again, thank you so much. And also, all my references are provided in the next two slides.